have a patient today who presents to the clinic with concerns of maturing skin. And with maturing skin, we know that we start to gain some loss of elasticity to our skin. We start to get some sagginess to the marionette and jowl areas and also under the eyes. So her biggest concern is the fatigue look, lack of a glow to her skin, and increase in pore size. So what we're choosing to do today is we're going to do what's called combination therapy on this patient. First thing we're going to do is we're going to enhance the collagen production by delivering a fractionated laser to the skin. By doing this, what we're going to do is we're going to help to not only tighten the existing collagen, but we're also going to influence the production of new collagen and tightening of the elastin in the dermis. After that, what we're going to do is we're going to proceed with a procedure called PRP, of which what we do is we take the platelets and we concentrate those from the patient's blood, and we're going to direct those platelets under the skin. And what we're going to do is we're going to promote a positive inflammatory oxygen-free radicals, plus what we're going to do is we're going to actually help to stimulate new collagen production through that. A combination of both those modalities will actually help to tighten the skin. It'll help to reduce the fatigue look, the fact that she's concerned about, and this will all happen within a matter of a few days with the PRP and on over a few months, in fact, with the lasers. So the patient will experience progressive improvements of, in fact, her skin quality, her skin texture, and the glow to her skin, and also the tightening of the skin on over the next 4 to 6 months. So we're going to proceed with, in fact, that treatment right now, and we've already preset our parameters for this patient. So we're going to start right now with the laser, and it's going to become a bit noisy, but that is okay. Okay, so we're going to start with the forehead, and here we go. So I just always like to tell the patient that you're about to experience a little bit. Ready? So the treatment is as simple as this. Virtually, I don't want to say pain-free, but it's definitely very little discomfort associated with it. We like to pre-treat the patient so that we can improve their comfort level, because it is heat that's being delivered to the skin. Generally, this laser itself has very little downtime associated with it. She can actually put makeup on as early as the next day. She will experience some dryness with it. She will experience some redness over the course of the next 24 hours that will last up to about 3 to 7 days. How much discomfort are you experiencing? None at all. So the patient has just expressed that she's absolutely pain-free, which is what we try to strive for. You know, some people will experience, everyone's a little bit different in their discomfort level. Some people will experience a bit of warmth with it. We do different levels of the laser depending on the area of the skin. So every once in a while you'll see me stop and I'll change the parameters. And the reason for that is that the laser will help us to direct it to the right levels depending on the area of the skin that we're treating. So that's it for that. So now I'll stop and I'll go ahead and I will go to a different area. And we're going to start with that. So we're going to start on the cheek area. Well, the thing is that there are different lasers, and different lasers have different purposes. So this laser is a nice, effective laser for, again, skin tightening, but the downtime is very minimal. Obviously, when we choose different lasers for different desired outcomes. We would choose a stronger laser if we were wanting to be a bit more aggressive with anti-aging for fine lines and wrinkles. People will often say to me, well, why do it? And, you know, two answers to that. It really depends on the state that our skin comes in. And the second answer is that basically it really depends on what our desired outcome is as well. You know, the type of laser we choose, the more aggressive, would obviously treat deeper lines. This one will have more superficial lines. But I would still often recommend a couple of treatments with this minimal. This laser is really quite neat because we're able to utilize this headpiece at a future date, and we're able to actually do a couple of treatments with this laser. So certain areas of the skin will have different sensitivity. So we often find right around the nose, we will have a bit more sensitivity. One over the upper lip will have a bit more sensitivity. But again, the patient is reasonably comfortable. I think she's experienced a little bit of discomfort, but from the perspective of degree, I would say she's probably closer to a lower 2, maybe 3 out of 10 for discomfort. Every once in a while, I'm going to stop and we're going to clean the headpiece off. So we hear a little bit of a noise every time I press a button here, and what that's doing is it's actually delivering. I always say when we aerate our dermis, it's like aerating our lawn, and that's literally what this laser is doing, is it's aerating the dermis by delivering microscopic little holes in the dermis. Everywhere one of those holes actually is delivered, it heats the underlying dermis, which helps to stimulate that collagen. Not only to tighten the existing collagen again, but to create new collagen. Scale 1 out of 10? 2. Yeah, so the patient has just said she's about a 2 out of 10 for discomfort. Very mild, and of course our more sensitive area around the nose and the upper lip. So I'm going to stop and just clean the headpiece again. This is her headpiece, and so you might question, okay, how sterile is this? This is actually a piece of laser, a cap that we actually put on over the laser. It has so many pulses built into it, and so you don't have to worry about, and this will be disposed of, so it is a disposable tip. Redness will happen. Sometimes it takes about a good hour for a person to appreciate the redness that they will experience, but it's very manageable and you can easily cover it up with makeup. And it's a beautiful computer because it really allows us to make sure that we're keeping the patient the tip as clean as possible, which really reduces any chance of any side effects. So now what I'm going to do is I'm going to go and I'm going to do her upper lip. So we're going to, so she's going to pull down like this. So it really helps to enhance the exposure of the area. We want to get it right on over those lip lines that everyone seems to hate as we start to get those in our 40s. Really important area that she was concerned about, most of us will be, is under our eyes, because we start to lose, if we have a good look here, we start to lose our collagen there and our elastin. So what we want to do is we want to tighten that. I like to really stretch the skin. I've got eye shields on her. Those aren't actually necessary in this treatment. You'll notice that I'm not actually wearing any shields because this particular treatment is color insensitive, and so it will not affect our eyes. But I put eye shields on just so that the patient doesn't have to worry about making sure that they, you don't bang their orbital rim and stuff. Just keeps them protected. Beautiful. Now she's going to get a bit dry, okay, after the treatment. So now I'm done the face, and you can see she was totally comfortable. Maybe a 2 out of 10 in certain areas for discomfort. So now what I'm going to do, and she just agreed to that, Now what I'm going to do is I'm going to go on the neck, and we're going to go ahead and we're going to do treatment there. So we're going to do that. And this is beautiful because we all know we start to get that little bit of loss of collagen over our neck. And she hardly has any freezing on her neck, so we do pre-freeze the face, which I always do. But you don't have to, but once again, I always think if we can make a treatment as comfortable as possible, all the better. But the neck, we have hardly put any freezing on her, so this is going to be a true sensation for her. And again, what's the discomfort levels?
Maybe a 3.
So she's seeing about a 3 now without freezing. Now this is also beautiful for the back of hands. I know often I'll get patients coming in quite concerned with the back of their hands thinning and showing, the fine lines. And often our hands are the first sign of our aging, believe it or not. And then it's our under eyes. So what we're going to do is we're going to go ahead and treat the back of her hands. So people will often say, because they'll read up on lasers, and there's so many lasers out there, and I think it must be very difficult for patients to know what lasers to choose, what fractionated means, what non-fractionated means. Fractionated laser is just a laser that doesn't deliver a total treatment to the entire treatment area. So what I mean by that is that areas of treatment, they'll leave parts of skin that are intact and parts that are actually treated, meaning injured. And so when we look at this, that's why when we look at the tip, we'll see all these little dots on there. So those little dots are where in fact the laser works. And so, but it'll leave non-treated skin intact, and that'll allow the skin to heal a lot quicker. In the olden days, we used to have very ablative lasers, meaning totally ablative. They took off all of the skin, and they tried to actually remove the superficial layers and go to a certain depth. But the downtime, the recovery time was about 3 weeks, and of course there was increased risk of burns and scarring, whereas lasers like this, the downtime is minimal because most patients don't have the opportunity to take that kind of time off work, and yet they're looking for something. So this is a beautiful advancement in treatments. And the results are almost as efficacious, if not as efficacious, depending on the type of fractionated laser, as a totally ablative laser. Just turn to the right. Perfect. So you can see she's got a little bit of flushing to the cheek area. I'm just going to take a moment and clean the tip. That we can treat. We can treat the décolleté area when in fact it starts to get some fine lines. That often is a concern. Treat the back of hands, full face, neck, under eyes. We're almost done the neck, and now we're going to do the back of her hands. So we're going to ask her to raise one hand and put it on her chest, so we can see this. So, we want to actually help to tighten this. Plus, we can see the sunspots that we often will get due to sun exposure on hands. So that's a different treatment. So what we want to do is improve the texture of the skin. And then down the road, what we would do is we would encourage her to do another treatment that actually removes the sunspots. I always say lasers are not necessarily good at doing everything. So we have to choose the right laser for the right treatment that we're looking at improving, or right condition of skin that we're looking at improving. So again, her hands have had absolutely no freezing on them. Scale 1 out of 10, 10, 0, 0 discomfort, she just said. So she will have some dryness. Whenever you heat the dermis, you're going to get an underlying inflammation, which is going to create a bit of dryness, but that will improve on over 5 to 10 days. So we're just going to ask her to hydrate it. Now we're going to do the other hand. very simple, very effective treatment. We can see that the patient is getting a little bit of redness. And again, the machine just tells me, reminds me to clean the handpiece. The next thing that we're going to do is we're going to be doing now PRP. Okay, so now what we've done, we've completed this treatment, and what we're going to do is we're going to proceed then to tightening the skin even further. So this is what we call a multimodality treatment for the skin. So what I'm going to do is I can take her actual eye shields off, and then what we're going to do is we're going to withdraw our blood. The blood is no different, to withdraw the blood is no different than when you go for a regular blood test. Then what we're going to do is we're going to put it into a centrifuge, and we're going to spin it at a certain RPM, which allows the platelets to really concentrate. And then what I'm going to do is I'm going to take and use a different treatment machine that's going to allow the re-injection of that. So it provides not only the microneedling, but we're going to re-inject that under the dermis. But right now, if we look at the patient, this is her afterwards, after a full treatment of laser. So you can see the downtime is very minimal. We do have to expect some redness. The occasional patient that will swell under the eye, if they do swell, that's a good thing actually, because what that shows is that we're getting that good positive inflammatory response, which is going to allow for that enhancement of tightening under the eyes or other areas that impact that we get that. It's very manageable though, and so people can often return to work. I usually like to give 24 hours, so not necessarily the day of the treatment. 24 hours later, I would ask them not to wear any makeup, and then the day after that, if they had to go back to work, it'd be completely fine. So, all right, so we're just going to take a break, and then we're going to go ahead and do the PRP.